question that's asked is if patients have a responsibility in healthcare, and if they do, what would they be? My answer is absolutely. Patients have a lot of responsibility when it comes to healthcare. First and foremost, all patients are responsible for themselves. When they come into the office, they give their complaint. They're expected to be honest, to let the physician know exactly what symptoms they're having, not to exaggerate in any way, although it is kind of up to the physician to decide whether or not they are exaggerating and to ask specific questions. The patients are also responsible for understanding that the physician holds an enormous amount of knowledge that they probably don't have, and that there may be some questions that they ask or some medications that they want to take that is not appropriate for the diagnosis or the symptoms that they have, and they may not fully understand that even with the physician's explanation, because there's a lot that goes on in our human anatomy that takes a doctor degree to actually understand fully what's going on. It's also the patient's responsibility to ask questions if they're not confident in what the physician is saying, or they don't feel like the physician has actually heard exactly what's going on with them. Then it is the patient's responsibility to ask questions to make sure he understands, and to make sure that they understand to an extent why the treatment plan is being put in place. And then once the patient leaves the office, they're ultimately responsible for everything that happens after that. They're responsible for picking up the medication, for taking the medication exactly as prescribed, for communicating with the physician if the medication is not working, for eating healthy, for exercising, for following up, for going to their appointments that have been scheduled for them, for following up on the referrals and making sure that they do go see the specialist, that they do go to physical therapy, that they get any lab work done that was requested of them at their office visit, or any imaging that they need to have done. Patients are responsible to make sure that they trust the physician and they are going to follow his plan of care. If they don't trust the physician, they're responsible to find a physician that they do trust, and to work together with that physician to make sure they have a plan that they're comfortable with. It's also the patient's responsibility, again, to communicate with the physician their financial needs. If a particular medication is too expensive and they're not going to be able to afford it, as embarrassing as it may be for some people, it is the patient's responsibility to let the physician know that that's out of their reach and that they need to prescribe something different that may help with their costs, so they're likely to be more compliant with that. Patients are also responsible for knowing what their plan covers on their insurance, and what their share of cost is going to be, what they're going to be responsible for, to a certain extent, what labs they can go to, what radiology services they can have, what their deductible is. That's not something that the physician's office needs to be concerned about. Although, it is a courtesy to make sure to let the patients know you do have, a $1,500 deductible. Ultimately, it's the patient's responsibility to know that these services are not going to be covered until they reach that deductible. So as you can see, the patients do have a significant amount of responsibility. It's not nearly as much as what it was 5-10 years ago. The healthcare workers are being held to a higher standard. They're expected to follow up on more and to kind of push the patients to, do what they need to do. But without the patient's compliance and without the patient following those instructions, there's no way that the healthcare workers can help them, without the patients ultimately being responsible for themselves. Thank you.